A new 4-year agreement has been reached between the government and the pharmaceutical industry, which both sides say will mean big savings to the state. €750 million is the figure mentioned. At the moment, the state spends a total of €2.4 billion on medicines every year. This new agreement includes benchmarking Irish prices against those paid in 14 countries. The 5 new countries are Greece, which is one of the highest drugs costs, Sweden, also high, Portugal and Luxembourg, which are among the cheapest, and Italy. Prices will be checked and realigned every year, and there will be a 50% price cut when a generic drug comes onto the market, competing against a drug that has expired. We're joined now by the Minister for Health, Simon Harris. Good afternoon.
Good afternoon, Audrey.
So will this agreement save the state €750 million?
Yes, I believe we will save 750 million. I believe we'll save at least 600 million euro over 4 years from the agreement with IFA, with the drugs industry group. And I believe we'll save another 150 million from the non-IFA companies. So about €750 million will be saved through this drugs deal, which has been really been worked on now for several months by both my own department and by colleagues in the Department of Public Expenditure and Reform, and indeed in the HSE. So I think today is a good outcome. We've had a drugs deal with industry for the best part of 40 years. As you probably know, when I came to office, I wasn't satisfied that the negotiated settlement was giving enough of a saving for the taxpayer. I went to Cabinet and asked Cabinet for permission to instruct the HSE to use legislation to set the reimbursement price if they didn't get a satisfactory outcome from negotiations. And as a result of that decision, the drugs industry and my officials and others came back to the negotiating table, and I think we have a very good deal in front of us today.
The figure is important because these huge sums, 750 million this time round, 400 million last time, they're always built into the budget figures for your department, but they never fully materialise, and they always contribute to you being over budget at the end of the financial year. You can't guarantee, can you, that figure of 750 million?
No, I think you make a very fair point, Audrey. In the past, Ministers for Health and indeed drugs deals have been announced, and I suppose the public have a healthy degree of scepticism until they actually see these savings achieved. But what I am confident of, and the reason I am confident that these savings will now be reached, is because of the levers that this deal gives the state. So, for example, you will actually have an annual check on prices, an annual reference pricing. So, and that pricing can only be downwards. You have obviously more countries in the basket, as you said in your introduction, so we're better aligned with some cheaper countries, which was hard fought for in negotiations, and I think has given us a good outcome. You have a situation where you have a larger rebate on drugs, both to the community schemes and to the hospitals. So I think what you have here are a number of new levers available to the state. You also have much more clarity and transparency in terms of the process that needs to be undergone when a new drug is being assessed. In my short time as Minister for Health, I've already seen on a number of occasions where a new drug has come onto the market, and quite simply a lot of confusion in relation to how is that drug assessed, a lot of public confusion into when will a decision be made. This talks very clearly, this agreement, about a decision being made within 180 days by the HSE. Who makes the decision? A greater role for clinicians in decision making, which is really, really important. So I think we have many more levers at our disposal this time, which gives me a degree of confidence that we will actually see these savings realised. Also, the very close cooperation between my department and the Department of Public Expenditure and Reform has been key to this successful outcome.
But the benchmarking process itself isn't fully transparent because it's done on the list price, but some of the countries get further discounts which aren't always visible.
I think you're right. They're obviously beyond the list pricing. There can also be other discounts in countries. But again, similarly, our own agreement will have other discounts. So the hospital rebate, which will be increasing from 5.25% to 5.5% from August 2018. The rebate paid to our community schemes will be increasing from 0.25% to 5.5% from August 2018. So you're right. The list price doesn't tell the full story. It is, though, a good indication. And each country then does have, I suppose, additional arrangements above and beyond that list price, but we have them here in Ireland also.
But how do you do the benchmarking? Do you take the average price of the 14? Do you take the average of the 3 lowest? Do you take the lowest? How is it done?
It's done on the average of the entire basket, with the one caveat, obviously the drug being referenced has to be available in all of the countries within the basket. But presuming the drug is available in the 14 countries, it will be the average price of the drug from those 14 countries in the basket.
Will it mean savings for patients buying their medicines in pharmacies? Will that be affected at all, or by much, by this agreement?
To be quite frank, I don't believe so. I believe that's a different process that we need to look at. We've seen some progress in this area in relation to cholesterol drugs and other drugs in recent years. What this is really about today in relation to patients is the fact that if we don't have this deal and if we don't save the €750 million over the next 4 years, it makes it extraordinarily difficult to find the headroom to purchase the new drugs that we want to purchase. So your listeners will all be aware of new drugs coming on stream in the area of cancer, in many other areas. And we want to be able to make new and innovative drugs available to our citizens. We have a very good record of doing that here in Ireland. But to do that, we have to create headroom. And without this deal, we saw drug prices going in one direction and one direction only, and that was up. What we will now see is the line, I suppose, flatlining in terms of drug prices. And that provides me as Minister for Health with the headroom when I go to negotiate with colleagues in terms of the estimates process for the money that's spent on drugs, not just to be spent on filling a black hole of rising costs, but actually to be put into the purchasing of new and innovative drugs as well, which I think is really important for patients.
It will still come to Cabinet, though, to decide on certain drugs at a certain price level. Now, why didn't you change that? Because you personally said before that you were not happy with having that power.
I'm not happy with that. I don't believe Cabinet should be playing God. I don't believe politicians should be making decisions in relation to life or death matters. I believe these should be made by clinicians. That's how I'd like my own family to be treated. It's how we'd like all our families to be treated. But I do think there's a little bit of a misrepresentation of the arrangement. I'd actually contend that there are actually structures in place which make it much less likely for any decision to come to Cabinet. In this new arrangement, there are 9 criteria that will be assessed by clinicians in terms of deciding whether to provide a drug or not. Only one of those 9 criteria relates to resources. There's also a very clear pathway in terms of how a decision is made. So it goes from Dr. Michael Barry's group, the National Centre for Pharmacoeconomics, to the HSE leadership team. And then only if the HSE leadership team doesn't have the resources does it come to Cabinet. But there's a very interesting development in the agreement, and I think one of the most important aspects of the agreement is that there will be a formal scan of what we're calling a horizon scan each and every July, where industry and the Department of Health and the HSE will sit down and will look in advance of the budget being put in place. We'll look at what drugs are in the pipeline. This will enable me and colleagues to decide how much to allocate to the drugs budget at a much earlier stage, so we can look at this in the context of the normal estimates process. What you don't want to have is what I've already seen to date, where I've had to bring a cancer drug to Cabinet and seek the approval of Cabinet to fund it. I don't think that's appropriate. It's much better that you'd actually look at these in an informed way, look at the pipeline, and that you would then decide how much you need to allocate in the estimates process. And I think the new agreement provides much greater clarity in that regard.
Minister, I just want to ask you about another issue within healthcare, but away from this drugs agreement. It was the RT Investigates programme last week, which showed hundreds of adults with intellectual disabilities literally forgotten about by the state over the last 30 years or so. They didn't know they were there. What did you think when you saw that programme?
I think I thought the same as probably every citizen watching this. I was repulsed, I was appalled, and I was ashamed. I think we have serious legacy issues in this country in relation to how we treat vulnerable people. I think a lot of work, and this is not a political point, I think a lot of work has been undertaken by many people and many organisations in recent years to make sure lessons are learnt from those legacy mistakes. But I think there's also a significant yearning for answers from the Irish public and from families, and indeed from myself as Minister. Myself and Finian McGrath, the Minister for Disabilities, met with senior officials in the HSE this week for 2 hours on Monday, I believe, and to talk about this and to talk about what the process needs to be to provide those answers. As you know, one of the last acts of the last government was to agree to set up a commission of investigation into a number of issues impacting on people in residential care. Conor Dignam, Senior Counsel, was taken on to do what I describe as a scoping exercise in relation to terms of reference for that. Mr Dignam is due to report to Finian McGrath at the end of this month, and I expect Finian to be in a position to bring terms of reference to Cabinet in September to get that investigation up and running, because it's not good enough to just say we have new procedures and new practices in place. That's really important. Things like HICWA, things like new standards, things like a confidential recipient for concerns, but we also must provide answers and closure indeed for families who quite frankly have been let down by this state in the past.
And one final question to you. Previously, in the last government, you were Minister of State with responsibility for finance. Today,
Yes.
Michael Noonan confirming that the state's contribution to the EU's budget this year will increase by over €250 million because of those those growth figures produced last week of 26%. That's ridiculous, isn't it?
Well, there is a link, as you know, between the contribution that a country makes to the EU budget based on its GDP. But it's also important to say that these negotiations in relation to how much any member state will pay haven't even started yet. These will be progressed now in the run-up to the autumn. And they depend on two things. They depend on a country's GDP, absolutely. But they also depend on the bigger pot. How much does every country pay in? So there's a huge body of work to be done in relation to that negotiating space. It's very important also, though, to say that whilst it's clear Ireland will be contributing more, our fiscal space will be the same. So it will not impact on the fiscal space available to the government in the budget, in a budget that we will so rightly depend on to deliver vital services.
But isn't that money better spent here, particularly when it's based on figures that simply aren't real?
Well, I suppose this country has seen sustained economic growth. I take the point you make in relation to the distortion with the 26% figure. And obviously all of these issues will be part of the negotiation. The negotiations haven't yet started. There's a lot of work to be done. And it will depend on not just Ireland's GDP, but also the entire pot of money, if you like, available to the EU from other member states. So there is some way to go in this, as the Minister for Finance has outlined.
OK, Simon Harris, Minister for Health, thank you very much indeed.